Hey guys, welcome to Warcalfrensel channel. In today's video, I'm going to give you some helpful tips and motivations about Nclex exam and how these tips helped me pass my Nclex exam. I took my Nclex exam last December 2021 and finished at 75 items within 1.5 hours. Please take note that these tips and motivations are based from my experience, and I hope I can help future nurses who are struggling right now in taking their Nclex exam. So please subscribe and like this video for more. Hey guys, so you're here looking for some motivation to study and pass the Nclex. You finished the registration and now you already have the schedule and just waiting for the big day. You've been depressed, having so many self-doubts, high anxiety level, and feel like you're going crazy. Trust me, we've all been there before and experienced that. But you know what? You can do it. Never let anyone tell you otherwise. You've studied one of the most difficult courses in college, surpassed not only the knowledge base but also the nursing skill, and you've provided appropriate patient care, then believe that you will pass the Nclex exam. You've gone through so much to give up in this process. Never stop studying and learning until you've got the confidence to pass the exam. Here are some tips and test-taking strategies that have been helpful for me. And again, these are based from my experience and I want to share to those who have been struggling in preparing their Nclex exam. Read and understand the question. This is one of the basic test-taking strategies. You need to understand the question, translate it to your own language, dissect it word by word, or get the base word of one word that you cannot understand, as long as you get the main question before you proceed to the choices and before proceeding to the next item. Next test-taking strategy is don't proceed to the next question unless you understood the previous one, or don't go down to the choices unless you understood the question. Now this is very helpful for me because it will make you more confused if you haven't understood the question and you proceed to the choices. It will point you to the wrong answer because you did not understand the question. Next is identify and make sure you know what is being asked. Example, accept the need for further teaching. Now this part of the question or phrase in the question is very tricky because sometimes we overlook the question and we are ignoring this word. So please be very careful with that. Next is sometimes you have no idea on the topic. Even if we try to understand the question, the choices can help you with the correct answer. Compare the choices that promotes the best nursing intervention, and there you go, you will get the correct answer. I don't know why, but usually the most critical symptoms in the choices is the adverse effect. So if you encounter adverse effect questions, choose the most critical. Works for me. Next is learn how to prioritize. Learn your ABCs, your airway, breathing, and circulation. Learn your Maslow's hierarchy of needs. Know who are the critical patients and not the critical patients. Repeat after me. I will be a safe nurse. I guess this is what Nclex is checking for us to have a license. If we know what we are doing and we always put in mind that the safety of the patient is always the priority. Next is look for the modifying phrase and review what you know about the case. Example, the topic is about myocardial infarction. Ask yourself, what do I know about this disease? What are the signs and symptoms of myocardial infarction? What are the common medications of myocardial infarction? What are the common side effects of the medications of MI? What are the common complications of MI? Now, this can be very helpful during the review. There will be times that you'll have so much self-doubt and you feel like your Q&A isn't going great. Take a break, deep breaths, relax and count to 10. Then go back to your game. During your review, prepare yourself to answer 145 questions every day. Condition your mind and practice answering 145 items. Don't panic if you didn't stop at 75 during your Nclex exam because you're still in the game. Give your best in the remaining questions. Based from my experience, hiatus from social media is a very big help. That way, you can concentrate on your studies. Turn off the TV and turn off your phone when you study. Just turn it on a regular schedule in case of an emergency. You can go back to all of these things after you pass your exam. Next is Find yourself a study buddy or a friend who can listen to you whenever you're having a breakdown. For me, I enrolled in an online Nclex review center in the Philippines called INAP. It's the best. You can meet colleagues with same experiences and they are very supportive. Plus, it's legit review center. They have like 100 plus passers every month. Check their FB profile because, a good support system is a great help. Next is trust the process. As long as you understand the questions and rationales during your review. Even if how many times you've answered the question for me, I've answered UWorld for how many times because I already finished their Q banks. And surprisingly, some of the rationals I still cannot understand up until before my NCLEX exam. So just trust the process and never stop reviewing because eventually you will be surprised that all of these things that you've learned and studied, it's there in your mind already. Next is repeat this every morning. I will pass this NCLEX exam. I will pass this NCLEX exam. I will pass this. Condition your mind. It's law of attraction. Think positive. You got this. I prepared for my NCLEX exam and studied for 3 months. I used UWorld for 3 months, Archer for 2 months, Remar for 1 month, and Lippincott for 20 days. I use Archer assessment every 3 days because it says in their website that if you get high or very high on your assessments, you have a high chance of passing. I did assessment every 3 days, and the advantage of Archer is they have computer adaptive tests. Also did UWorld assessment. For me, UWorld is highly recommended. It's one of the best Q banks because they got extensive rationale question for you to easily understand. It is slightly expensive compared to other Q banks, but it is worth it and it's a good investment. Tried Remar and their assessment is okay. They have no computer adaptive tests and plainly it's knowledge based questions. So, yeah, for those who have no idea on the topics and you still want to learn more, it's Remar. Also try the Lippincott or the Pass Point by Walter Kluwer. It's also highly recommended. It's one of the best. They have the most extensive question and for me it's more similar questions in Nclex between Lippincott. I just came to know Lippincott like 20 days or 10 days before my exam, but it is really good. It's highly recommended and I advise you to try it if you have the time to try it. Always remember, whenever you find yourself doubting if you can go on, just remember how far you've come. Remember everything you have faced and all the battles you have won and all the fears you have overcome. You can do this. You got this. If you feel like you're not learning, look back at where you came from and let yourself feel proud about your progress. Believe in yourself, push your limits, experience life, conquer your goals, and be happy. Listen and tell yourself, you have what it takes. Don't ever doubt yourself. There are people who always pray for your failure, and I'm telling you, they are everywhere based from my experience. But you know what? Ignore them and focus on your circle. Show them you will succeed. This may be hard, but you know what? Wake up, turn off your phone, drink some coffee, concentrate, and focus. If you really want to pass this NCLEX exam, you need to do this. Mind over matter. Always think positive. Always think that you will pass this exam. It's law of attraction. Whatever you are thinking, think that you can do this. You've worked hard for this. You've passed the nursing school. Now it's time to get your license and claim it because you got it. You got what it takes to be a passer of NCLEX. You got what it takes to be a USRN. And there you have it, guys. I hope this motivational video, this test taking strategies, and these tips are helpful for you, same as it has been helpful for me during my preparation for my NCLEX exam. And share your thoughts if it has been helpful for you, and I am open to any suggestions. Good luck, guys, and see you on the field. Please don't forget to like and subscribe into our channel. God bless you. Stay safe.